Today we're going to continue our series with a lecture on the oral health care in medically compromised individuals. And this will be in two parts. The first part is about patients with cardiovascular and cerebrovascular diseases. The learning objectives. On completion of this module, participants should be able to identify common cardiovascular and cerebrovascular disorders, discuss how to assess and manage such patients in the dental chair, and in the event of an emergency, stabilize the patient until emergency services arrive. Cardiovascular diseases are those which affect the heart and vascular system and include ischemic heart disease, hypertension, dysrhythmias, congenital heart disease, heart failure, and infective endocarditis. Cardiovascular disease is a leading cause of death in many Southeast Asian countries and is on the increase. Dentists need to be able to manage patients with cardiovascular diseases, including emergencies that occur in the dental clinic. When managing patients with cardiovascular diseases, there are several general principles that we can follow. Firstly, try to reduce stress during the dental appointment. To do this, ensure that we have effective local anesthesia, usually with an agent that contains adrenaline. In anxious patients, consider the use of a pre-medication, such as diazepam 5 to 10 milligrams the night before and 1 or 2 hours before the appointment, or nitrous oxide sedation. Short morning appointments are preferred, and we should support the reduction in any risk behaviors that they might have, such as smoking or a high sugar and fat diet. Let's look at hypertension first. Hypertension is defined as being where the blood pressure is more than 140/90. If the blood pressure is over 180/110, then they need urgent referral to their medical practitioner. Hypertension is a significant risk factor for cardiovascular disease, myocardial infarction, cerebrovascular accident, and vision loss. But if well controlled, hypertension is of very little risk for routine dentistry. If not well controlled, there's a higher risk of adverse events during dental treatment. And of course, anxiety can cause increases in blood pressure in the dental clinic. Some clinical points. Take medications as normal on the day of treatment. We should measure the blood pressure before starting treatment and sometimes during treatment. Reduce anxiety, for example, with the use of good local anesthesia, and use local anesthesia with adrenaline if the blood pressure is under good control. In the event of a hypertensive emergency, we should place the patient in an upright or semi-reclined position, give oxygen, monitor their vital signs, and call an ambulance. Some of the symptoms of a hypertensive episode are shown here. Things like headache, lightheadedness, nausea, shortness of breath, heart palpitations, a bleeding nose. These are all signs that we should take note of. The next cardiovascular condition is angina. And chest pain or angina occurs when the coronary arteries are partially blocked. We may get pain when exercising or climbing stairs. There's an increased risk of angina attack if the patient is anxious or experiencing pain. Some clinical points. If the patient has angina medication, they should bring it to the appointment. This is usually glyceryl trinitrate. Short morning appointments are better, and they should be given a pre-med or nitrous oxide sedation if they're very anxious. Give good local anesthesia with aspiration. After treatment, raise the patient up slowly from the supine position to avoid orthostatic hypertension, as they may faint. If the patient has an angina episode during treatment, stop the procedure, put the patient in an upright or semi-reclined position, use glyceryl trinitrate spray under the tongue or a sublingual tablet. This can be done every 5 to 10 minutes for a maximum of 3 doses over 15 minutes. The pain should dissipate. Monitor their vital signs and give oxygen if necessary. If the chest pain continues for more than 10 minutes, call an ambulance and send them to the hospital. Myocardial infarctions occur when the coronary artery is blocked, leading to myocardial necrosis. The patient may experience severe chest pain that can radiate to the left arm, neck, shoulder, and jaw, and it's not relieved by glyceryl trinitrate. This can lead to a cardiac arrest, and in fact 50% of those who have a myocardial infarction die within the first hour. Avoid elective dental treatment within 6 months of the patient having a myocardial infarction. When managing a myocardial infarction that occurs in the dental clinic, seat the patient upright or in a semi-reclined position. Give aspirin orally, as this reduces the mortality by about 20%. Give oxygen, monitor the vital signs, and call an ambulance. The next condition is cardiac arrhythmias. This is where there's an abnormality in the rate, regularity, or site of origin of the cardiac impulse. Harmful arrhythmias are more common in patients who have cardiomyopathies, heart failure, and valvular problems. Some clinical points: reduce their stress and anxiety. If an arrhythmia develops during treatment, stop treatment and provide oxygen, and monitor their vital signs. Some of these patients may have a pacemaker. A pacemaker is a small electrical device implanted into the chest to regulate the heartbeat. Others might have an implantable cardioverter defibrillator or an ICD. These are used in patients who are at risk of sudden cardiac death due to ventricular fibrillation and ventricular tachycardia. The ICDs will automatically deliver a shock to the heart. Some clinical points: in these patients, avoid the ultrasonic scaler and electrocautery. However, piezoelectric scalers are safe to use. The next condition is heart failure, and this is the inability of the heart to function properly, pumping insufficient blood to the tissues and leading to fluid accumulation within the lungs and the peripheral tissues. For these patients, only provide routine treatment if the patient is in a stable condition. Treat in the semi-supine position, and if taking digoxin or methyl-digoxin, limit the local anesthetic to 2 cartridges. Here you can see some of the signs of the patient who is in heart failure. The next group of patients are those who are at risk of infective endocarditis. Infective endocarditis is an infection that affects the inner lining of the heart and the heart valves, and it can be life-threatening. It usually develops in people with structural cardiac defects, which can be congenital or acquired, who then develop a bacteremia involving bacteria which can cause endocarditis, most commonly Staphylococcus. The bacteria can lodge and grow on or near damaged or abnormal heart valves, causing endocarditis. Bacteria include the Viridans streptococci from the oral cavity, and they can enter the bloodstream following certain dental or oral surgical procedures. At-risk patients should maintain excellent oral hygiene and see their dentist regularly. Recommendations vary from country to country concerning whether they should have antibiotic prophylaxis prior to dental treatment. In the UK, no antibiotic prophylaxis is recommended for any patients at risk of endocarditis. But in the US, Australia, New Zealand, and Europe, antibiotic prophylaxis is recommended for selected high-risk cases. However, there is a lack of evidence to support either view. As an example, these are the Australian recommendations. They recommend antibiotic prophylaxis in high-risk patients who, for example, have a prosthetic heart valve or prosthetic repair material, or patients with previous infective endocarditis, or patients with certain congenital heart diseases such as unrepaired cyanotic defects, or if there's a history of rheumatic heart disease and they're in the high risk of endocarditis group, or heart transplant patients. In these high-risk patients, prior to a dental procedure likely to cause bacteremia, they are given 2 grams of amoxicillin 1 hour before treatment and no follow-up dose. In the past, it's also been recommended that patients with prosthetic joints may benefit from antibiotic prophylaxis. However, there's a lack of evidence that oral microorganisms are associated with joint infections. In 2015, the American Dental Association stated that in general, for patients with prosthetic joint implants, prophylactic antibiotics are not recommended prior to dental procedures to prevent prosthetic joint infection. However, you may find that the patient's doctor or surgeon recommends antibiotic prophylaxis. What should we do? In those cases, we should ask the doctor or surgeon to prescribe the antibiotics themselves rather than the dentist prescribing them. The next condition that we're going to talk about today is the cerebrovascular accident, or CVA, commonly called a stroke. This occurs where there's a loss of blood flow to part of the brain, which results in damage to the brain tissue. And there are two types of CVAs. The first one is caused by a blood clot in the brain. This is called an ischemic stroke. The second type is where there's a broken blood vessel in the brain, or a hemorrhagic stroke. There's also a condition called the transient ischemic attack, or TIA, which is a warning for an impending stroke. Sometimes we call this a mini stroke. To prevent strokes in the dental clinic, in patients who are susceptible, we should organize stress-free morning appointments, check their blood pressure, as high blood pressure is associated with stroke. If taking warfarin, an anticoagulant, check the patient's INR before invasive treatment. And in patients who have had a TIA or a stroke in recent months, remember that they are at higher risk of another stroke, so be particularly careful in that group. The risk factors for stroke include high blood pressure, smoking, diabetes, high blood cholesterol, heavy drinking, and a high salt and fat diet, and lack of exercise. Symptoms may include a headache, dizziness, numbness, weakness on one side of the body, and problems with talking, writing, or understanding language. To quickly assess whether the patient has probably had a stroke, we can apply the FAST principle. The F stands for face drooping. So if one side of the face has drooped, that's a sign of stroke. The second one, A, is for arm weakness. Ask the patient to lift up both arms. Maybe one arm does not lift up to the same extent as the other arm. S is for speech difficulty. So are they having trouble speaking? And T is for time. And it's important that patients with stroke are transported to the hospital quickly. So time to call 911. If a patient has had a stroke in the dental clinic, take care of the ABCs, the airway, breathing, and circulation. Administer oxygen. Monitor their vital signs. If the patient is unconscious, put them in the recovery position. Call emergency services and get them to the hospital. Once at the hospital, they'll have a brain scan. And if an ischemic stroke is diagnosed, normally they'll be given a thrombolytic drug, for example, tissue plasminogen activator, or TPA. Note that the symptoms of stroke can be similar sometimes to the symptoms of hypoglycemia. So keep that in mind. In summary, for patients with cardiovascular disease and cerebrovascular disease, good oral hygiene and good oral health are important. They should have regular dental checkups. We need to take a good medical history and communicate with the patient's doctor if necessary. We want to reduce anxiety during their dental visit. We want to make sure that we use effective local anesthesia and monitor the patient during treatment. And always be ready for any emergency that may occur. Here is some further reading.